Have you ever looked in the mirror and wondered when your body started feeling just a little more distant, a little less like your own? It's a quiet shift that sneaks in with age. For many men, it's not marked by pain or illness, but by something they rarely speak of: touch, intimacy, and the fading connection to one's own body. What if I told you that one simple act, often overlooked and even dismissed in later life, could be playing a much bigger role in your health than you realize? This isn't about taboo, it's about truth. Because what you stop doing in private may be quietly affecting how you sleep, how you think, how your heart beats, and how alive you feel each day. I'm Dr. Mark, a urologist who spent over 30 years helping older men understand their bodies more deeply. And in this video, I want to share with you something most doctors never say out loud, but should. If you're someone who cares about staying sharp, strong, and independent, I invite you to keep watching. What you'll discover might just change the way you care for yourself from this day forward. 1. Decreased prostate health and urinary function. When I first began my journey in urology over 3 decades ago, I never expected that one of the most recurring and vulnerable conversations I'd have would center around something many men are taught to keep quiet: their fading sexual habits in later life. I remember one patient clearly, a man named Walter, in his early 70s. He was in great shape, mentally sharp, carried himself with confidence. But he sat across from me one morning and said, almost like a confession, "Doc, I just figured I didn't need that part of life anymore." Yet what brought him in wasn't about intimacy. It was about something more frustrating. He had started waking up 4 or 5 times a night to urinate and couldn't understand why. What Walter didn't realize, and what many older men are never told, is that regular ejaculation, even through self-stimulation, plays a vital role in maintaining the health of the prostate. The prostate isn't just a silent bystander in your body. It is a dynamic, responsive organ that expands, contracts, and produces the fluid that carries sperm. And like any part of the body, when it's neglected, it starts to show signs of stress. Without regular stimulation and release, the fluid produced by the prostate can stagnate. Over time, this creates a perfect environment for inflammation and swelling. That's when symptoms begin to show up: a heavier bladder, a weaker stream, a lingering pressure or fullness that won't go away. These signs aren't just annoyances. They're your body trying to speak to you. And if ignored, they can evolve into more serious issues, like benign prostatic hyperplasia, or BPH, a condition that affects nearly half of all men over 60. Left unmanaged, it can lead to urinary retention, bladder infections, and even the need for catheterization or surgery. Walter eventually needed a procedure to relieve that pressure. But it didn't have to reach that point. Something as simple as maintaining regular, healthy self-stimulation might have spared him from months of discomfort and disrupted sleep. There's real science behind this. Studies show that men who ejaculate 21 times or more each month are significantly less likely to develop prostate cancer. And no, this isn't about trying to turn back the clock or chase fantasies of youth. It's about using what nature already gave you to care for the body you're still living in. When older men stop masturbating, they often don't realize they're giving up more than just pleasure. They're risking inflammation, disrupted sleep, loss of control over urination, and a growing sense of frustration or even embarrassment. I've had patients avoid travel or social events because they didn't trust their bladder. I've seen strong, self-assured men lose their confidence to something they could have addressed with a simple act of presence. And what begins in the prostate doesn't end there. In the next part of this journey, we'll talk about how this change reaches further into your thoughts, your focus, and your emotional clarity. Because once the mind starts to fog, the path forward becomes even harder to see. Let's continue with point number 2. 2. Cognitive fog and reduced mental clarity. A few months ago, a man named Robert, 68 years old, came into my office. He wasn't in pain. He wasn't dealing with prostate trouble or chronic fatigue. He simply looked at me and said, "Doc, I don't feel like myself anymore. I walk into a room and forget why I'm there. I lose my words mid-sentence. I used to be so sharp. Is this just what getting old feels like? That question has stayed with me because I've heard it so many times before. And while aging does bring natural changes to the mind, what most people don't realize is that sexual activity, including masturbation, plays a quietly powerful role in protecting your brain. Each time you engage in self-pleasure, your brain releases a surge of important neurochemicals: dopamine, serotonin, oxytocin. These aren't just feel-good hormones. They are the very substances that keep your mind alert, your emotions balanced, your thoughts clear. They help improve blood flow to the brain. They reduce cortisol, the stress hormone that in large amounts begins to wear away at your mental sharpness. These moments of pleasure are actually moments of protection, of restoration. Now, imagine what happens when you remove this part of your life entirely. No more chemical boost. No more stimulation. No more gentle surge of energy to the brain. Over time, the absence of these natural processes begins to dull the mind. You might notice it slowly, forgetting a name, struggling to follow a conversation, losing your train of thought more often. And soon, it becomes easier to doubt yourself, easier to believe something is wrong, even when no one else sees it. That's when fear sets in. And with fear often comes withdrawal. I've seen proud men stop going to their book clubs, their chess nights, their breakfast groups, not because they didn't want to go, but because they didn't feel mentally present anymore. They were embarrassed to stumble over thoughts. They felt less like themselves. And in many cases, this fog didn't need medication. It needed connection. Not just with others, but with their own body, their own inner rhythm. In men, there's another layer to this: testosterone. A hormone linked to memory, motivation, decision-making, and vitality. When sexual activity disappears, testosterone levels may decline faster, and this affects far more than desire. It changes the way a man feels in his own skin, his energy, his confidence, his clarity. Studies have even begun showing that reduced sexual activity in older adults may be connected to early cognitive decline. No, I'm not saying lack of self-stimulation causes dementia. But I am saying this: when the brain is deprived of stimulation, emotional release, and hormonal balance, it becomes more vulnerable. It loses its flexibility, its sharpness, its spark. Robert isn't alone. And if you've been feeling like your mind is a little more distant lately, perhaps this message is for you too. Because sometimes healing the brain doesn't start in a pharmacy. It starts in the quiet choice to care for your body again, to give it the attention it gently asks for, to remember that clarity, connection, and vitality are still within reach. And next, we'll talk about something even more delicate. What happens when emotional balance starts to slip away without you even noticing? When the loss of physical intimacy begins to invite a quiet sadness that lingers beneath the surface. 3. Heightened depression and emotional numbness. There was a moment I'll never forget, sitting with Richard, a retired widower in his early 70s. He came in not because of pain or illness, but because something inside him felt off. He looked me in the eyes and said, "I don't feel anything anymore. Not sadness, not joy, just flat." Then, almost as if asking permission to feel that way, he added, "Is that normal for someone my age?" That question has stayed with me for years, because what he described, that slow fading of emotion, is something I've heard from many older adults. And while some assume it's just another part of aging, it often has a deeper, more physiological root, one tied to the quiet disappearance of self-intimacy. You see, when someone stops connecting with their body in an intentional physical way, something subtle but profound begins to shift. Masturbation, especially in later life, isn't just about seeking pleasure. It's about release, about keeping the emotional engine of your nervous system running. During orgasm, your brain floods with oxytocin and endorphins, natural chemicals that ease anxiety, soothe the mind, and lift the spirit. When that release disappears, especially during times of stress, loneliness, or grief, the emotional system begins to dull. That numbness may not feel like sadness at first. It feels like nothing. But over time, that emptiness can turn into something heavier: depression. I've watched it unfold more times than I can count. A man loses his partner or simply decides intimacy isn't age-appropriate anymore. Days become weeks, then months. He stops doing the things he once enjoyed. He speaks less, moves less. His sleep changes. His appetite fades. Life begins to lose its color. And he blames himself, or worse, assumes this is just what old age feels like. But it's not. What many of them are missing is a simple act that reconnects them to life, not for fantasy, but for emotional well-being. Depression in older adults doesn't always show up as sadness. It often arrives as fatigue, detachment, loss of motivation, or the quiet absence of desire. And while therapy and medication can help, I've seen remarkable change from one simple invitation to reconnect with their own body, even gently. One man told me, "I feel human again, not just a body waiting to shut down." That moment of touch gave him back a part of himself he thought was gone. So, let me be clear. This isn't about indulgence. It's about vitality. It's about giving your body a reason to feel, to engage, to remember that it still matters. Because when you lose that connection, you don't just risk sadness. You risk forgetting what it feels like to be fully alive. And now, as we continue, let's explore another quiet cost of letting go of self-intimacy, how it may be silently stealing the deep healing sleep your body needs more than ever. 4. Poorer sleep quality. A man named Gerald, 69 years old, once sat across from me, eyes heavy, face pale, shoulders tense from months of restless nights. "Doc," he said with quiet desperation, "I fall asleep just fine. But at 2 in the morning, it's like someone flips a switch. I wake up wide awake, heart racing, staring at the ceiling until the sun comes up." We did the usual workup. His blood tests were normal. No sign of sleep apnea. No major health issues. But when I gently asked about his intimate life, he looked down and said, "That part of me is over." But what Gerald didn't realize, and what so many older adults are never told, is that the very part of him he thought had faded away might have been the key to the rest his body was craving. Because sleep is not just about lying in bed with your eyes closed. It is a delicate dance of hormones, a sequence of physiological cues that guide your body from alertness into healing. And one of the most powerful natural signals for that transition comes from orgasm. During climax, your body releases oxytocin, prolactin, and endorphins. These chemicals are nature's way of telling the brain, it's safe now, you can let go. They slow your breathing, lower your heart rate, relax your muscles. And just as importantly, they sharply reduce cortisol, the hormone behind anxiety and wakefulness. The body enters a state of peace, the mind softens, and sleep comes naturally. Now imagine going weeks, months, even years without that process. That's what happens when older adults stop engaging in self-intimacy. The body loses a powerful built-in tool, and in its absence come the long nights of tossing and turning. Some turn to pills, others simply accept that feeling tired is part of getting older. But the truth is, it doesn't have to be. Chronic poor sleep isn't just tiring. It weakens the immune system, fogs the mind, raises blood pressure, and makes depression more likely. For older adults, it also increases the risk of falls, memory lapses, and loss of independence. I've watched vibrant, capable individuals gradually shrink from life, not because of any disease, but because they were too exhausted to keep up. And the saddest part? Many didn't realize what they were missing. Not a drug, not a supplement, but something their own body had always known how to do. One man told me, "After I started again, I slept like I was in my 40s. I didn't even know how much tension I was holding until I let it go." That's the mistake we make too often. We assume this is just what aging feels like. But sometimes, what we're calling aging is actually neglect, a quiet forgetting of the rhythms that once sustained us. So if you find yourself staring at the ceiling, muscles tense, mind racing, ask yourself gently, When was the last time your body truly relaxed? When was the last time it let go completely? Because sometimes the answer is not in a bottle or a breathing exercise. Sometimes it's about coming home to yourself, to a rhythm your body still remembers. And in the next section, we'll see how letting that rhythm fade doesn't just affect your sleep. It begins to show up in your strength, your circulation, and the muscles that hold everything together. Let's explore what really happens to your pelvic floor and blood flow when intimacy quietly disappears. 5. Weakened pelvic floor and blood circulation. A few years ago, I met Thomas, a retired firefighter in his early 70s. For most of his life, he was the image of strength and discipline, someone who had carried others through fires and storms. But that day in my office, he looked uneasy. "It's strange," he told me. "I feel like the foundation of my body is slowly giving out. I leak a little when I laugh or sneeze, and I can't stand for long without this nagging ache in my lower back." What Thomas was describing wasn't simply aging, it was the gradual weakening of his pelvic floor, and he was far from alone. The pelvic floor is a group of deep muscles at the base of your core. They support your bladder, bowel, and sexual organs. They are the quiet guardians of your lower body, and most people never give them a second thought until something goes wrong. Urinary leakage, constipation, loss of control, discomfort while moving or sitting. For many, these issues seem to appear suddenly, but they don't. They build up slowly, often because these muscles haven't been used in the way they were meant to be. One of the simplest, most natural ways to keep these muscles active is through sexual stimulation. Yes, even masturbation. During arousal and orgasm, the pelvic floor contracts rhythmically. It's not just a moment of pleasure. It's exercise. It's communication between nerves and muscles. It's blood flow moving where it's needed most. And it helps keep those deep internal muscles alive, flexible, and strong. When that stimulation stops, those muscles don't just sit idle. They begin to shrink. Blood circulation weakens. Tissues lose elasticity. Nerve signals fade. Before long, the body begins to send warning signs. Frequent urges to urinate, dribbling after using the bathroom, trouble holding in gas, discomfort in the hips. And for many men, this can also mean a loss of sexual function. For women, it may lead to dryness, tension, and pain that makes any kind of intimacy feel out of reach. I've seen proud, independent older adults begin avoiding social gatherings because they no longer trust their bladder. I've seen others quietly slip pads into their clothing or plan their day around proximity to a restroom. They never realized that what they were dealing with wasn't just aging. It was neglect of the very foundation that supports their physical autonomy. What breaks my heart is that so many suffer in silence. They feel ashamed or resigned, thinking this is just how things go. But it doesn't have to be. Your body still wants to function, even now. And one of the most effective ways to support that function doesn't come in a bottle or device. It comes from within you. Safe, regular, intimate self-connection can restore strength where it matters most. It reminds your body that it still matters, that it's still alive and worthy of care. Because when you reconnect with your own body, you're not just reigniting pleasure. You're reviving circulation, you're strengthening muscles, you're preserving dignity. And now, let's explore how this quiet disconnection doesn't just affect the lower body. It reaches even deeper into your bloodstream and your immune system. Let's talk about how the loss of sexual activity could be quietly weakening your ability to fight disease. 6. Lower immune function. A few winters ago, my longtime patient Michael, a 68-year-old man who had always been fairly resilient, walked into my office looking visibly drained. "Doc," he said with a half smile, "I've been sick 3 times this season. Used to bounce back in a day or two. Now every little cold knocks me flat for weeks." We looked at everything. His diet hadn't changed. He was sleeping fairly well. No major changes in medication. But something in his tone made me pause. I gently asked, "Have you been sexually active at all? Even just with yourself?" Michael looked away, chuckled softly, and said, "Nah, that part of me retired a while ago. What Michael didn't know, and what many people never hear, is that sexual activity, including masturbation, has a profound impact on your immune system. This isn't some metaphor about energy or mood. It's pure biology. When you experience sexual arousal, especially orgasm, your body produces a remarkable chemical response. Yes, you get dopamine and oxytocin, the feel-good hormones. But you also get a surge in immunoglobulin A, or IgA, one of the key antibodies that help defend your body from infections, particularly in the respiratory and digestive systems. Along with that, your body releases endorphins that help reduce inflammation and promote healing. It's like a full-body wellness signal saying, "We're safe, we're strong, we're recovering." Now imagine your body going without that signal, not for days, but for years. That's what happens when sexual stimulation disappears in later life. One of the simplest, most natural boosts to your immune system gets silenced, and the body, already coping with age-related immune decline, begins to lose one of its quiet protectors. I've seen this firsthand. Older adults who stop engaging in self-intimacy often find themselves getting sick more often, taking longer to recover, and struggling with chronic inflammation that seems to have no clear cause. And yet they rarely make the connection. They assume they're just getting old, but their bodies are waving a red flag, asking for something they've forgotten they still have access to. And it's not just about fighting off colds. The immune system plays a central role in preventing long-term disease, from cancer to heart conditions to wound healing. When sexual activity drops out of your life, hormonal balance begins to shift. Cortisol rises, circulation slows, stress builds, sleep weakens, and with it, the immune system stumbles. I remember a woman named Lorraine in her 70s. She had lost her husband several years earlier and told me she hadn't touched herself since. But after we had an honest conversation about the connection between sexual release and immune health, she hesitantly gave herself permission to try again. Months later, she came back into my office with a lighter step and clearer eyes. "I don't know how to explain it," she said, "but I feel like my body is working with me again, not against me. That's not magic. That's biology responding to care. That's what happens when your body gets the message it's still needed, still wanted, still worth fighting for. Because your immune system doesn't judge. It doesn't care about embarrassment or hesitation. It only responds to what you do. And sexual stimulation, even solo, is one of the most natural actions you can take to help it stay strong. But as important as your immunity is, the next consequence runs even deeper. When you stop touching your body, you might start forgetting who you are. Let's explore how neglecting intimacy can quietly wear down your sense of self, and how you can gently begin to rebuild it. 7. Loss of body ownership and self-worth. I still remember a quiet afternoon conversation with James, a 77-year-old retired school principal. He had once been a man of great presence, confident, sharp, someone whose voice could command attention with just a few words. But that day, as he sat across from me for a routine checkup, something about him felt dimmed. His shoulders were slightly hunched, his gaze lower than usual. At one point, he sighed and said, "I don't really feel like I live in this body anymore. I just feel like I'm borrowing it." That sentence stayed with me, because it echoed something I've heard many times over the years, from both men and women. A quiet disconnection, a slow drifting away from the body they once called home. For many, this begins with the silent choice to stop engaging in self-intimacy, not out of shame or trauma, but simply from believing it's no longer necessary, that they've outgrown it, that it belongs to a chapter long closed. But what they don't realize is that when you stop touching your body, when you stop acknowledging it in that personal, present way, you also stop seeing it as a part of who you are. You begin to feel like a visitor in your own skin. Self-touch, even in its simplest and gentlest form, is not just about desire. It's about recognition. It's a way of telling your nervous system, "I am still here. This body still belongs to me. I still matter." Without that message, it becomes easier to turn away from your reflection, to overlook small aches, to feel like aging is a slow erasure of everything that once made you feel alive. I've seen this disconnection lead to more than just emotional numbness. It leads to neglect, of self-care, of movement, of joy. People stop eating with intention, dressing with care, or exercising not because they lack discipline, but because they no longer feel worthy of the effort. One woman, Susan, shared with me that she hadn't touched herself since menopause. "I just stopped feeling like a woman," she said softly. "And the less I touched myself, the more invisible I became." That word, invisible, cuts deep. Because that is what many older adults quietly experience. Not just a loss of pleasure, but a loss of identity, of worth, of presence. But here's the truth I want you to carry with you. It doesn't have to be this way. Reconnecting with your body is not about returning to how things used to be. It's about honoring what still is. It's about reminding yourself in the privacy of your own space that you are still here, that your life, your presence, your body still deserve tenderness, still deserve acknowledgement. And in that simple act of connection, you begin to reclaim something powerful, not just intimacy, but the quiet dignity of knowing you still belong to yourself. Now, as we approach the final message of this journey, let's bring it all together. Because each of these 7 consequences tells its own story. But together, they reveal something deeper about health, aging, and the power we still hold. Let's talk about what's truly at stake and how you can begin reclaiming your well-being from this very moment forward. As we grow older, it's not just the body that changes, but the quiet ways we start to drift from ourselves. Yet within each of us remains a quiet strength waiting to be remembered. Reclaiming your sexual self is not indulgence, it's healing. It's saying yes to life, to presence, to dignity. If this message touched something in you, take a moment to subscribe and leave a comment with the words "still alive." You matter. And in our next video, we'll continue exploring ways to stay connected to the body and soul you still call home.